Hello, everyone. This is the Ophthalmology Business Podcast, where we help you develop your ideal practice with the help of other doctors and experts. The topics we cover include marketing, management, leadership, recruitment, HR, mindsets, and more. I am Naren Arul Raja, the founder and one of the co-hosts of this podcast. Every listener of this podcast is welcome to join the Ophthalmology Business Academy, www.obacademy.org. The membership is on us, and it's our gift to you. Today, I'm excited to talk to Christine Lapointe. I hope I didn't butcher your last name, Christine, so I'll have you pronounce it for us. Director of Growth Programs at Eyecare Partners. And she's an entrepreneur herself. She started, back when, a really popular platform called Aesthetics 360. The conversation we're going to have today is all about patient education and patient readiness. And specifically, we're going to be focusing on cataract patients. And specifically, we're going to talk about what should the patients know, how do we help them get to know those things, how do we educate them before they meet the doctor. So, Catherine, welcome to the podcast.
Thank you for having me. And you did say it correctly. So it's Christine Lapointe. It's correct.
Oh, perfect. Thank you. Thank you for helping me with my confidence. Appreciate it. Before we get started, Christine, let's talk a little bit about you and how long have you been working in ophthalmology? Just kind of get your bio so people know who you are and kind of where you come from.
Sure. Thank you. So I actually started in ophthalmology in 1996, right around the FDA approval of PRK. So I left sales to work in laser vision correction. And from that, my background evolved to work in private practice. I managed multiple laser centers, and then I went to work for two medical device companies, Intralace and Advanced Medical Optics. And with those companies, I did a lot of business development. And then I left Advanced Medical Optics and formed my own company called Aesthetics 360 with my business partner. Her name was Laura Jackson. So we decided to leave ophthalmology and go into aesthetics. But we got pulled back into ophthalmology, and we did a lot of consulting in the US, in Canada, a lot of consulting for Johnson & Johnson in Canada. We consulted in the UK and in India, and we worked with a lot of medical device companies in the US and private practices. We predominantly focused on fee for service. So a lot of our business revolved around either advanced technology, cataract surgery, laser vision correction, and aesthetics. I now work for Eyecare Partners, which is a private equity company, and I am the director of growth programs.
Thank you for that. This is awesome. So let's dive into our conversation today. Of course, it's going to be a fun conversation. It's all about educating patients, especially cataract patients. So let's start at the beginning. Why do you believe in, educating or pre-educating patients even before they meet the doctor for the first time? You have worked with hopefully hundreds, if not thousands of patients through your career. Why do you think this is important?
Thank you for asking me that question. So one of the things about patients that come into our practices is that there's something wrong with their vision. Usually that's why they come in, right? They're anxious, they're looking for a solution. They're not sure what's going to happen. And it's very difficult to take in all the information right when they're sitting with the doctor. So study after study after study, even way back in vision correction, tells us that the more education we can give to patients before they come in helps them be better prepared. And better prepared means they're better prepared to listen to the diagnosis. They're more able to ask better questions when they get to see the doctor, and they're not as overwhelmed when they get the diagnosis. So the pre-education and the consistent message, we hope once they hear it repetitively, helps them become better patients. And ultimately, I would say patients that are better prepared tend to be more compliant patients, and they tend to have better expectations.
So let's talk about the pain, right? Let's say we don't pre-educate. Can you talk about what are some of the pain that this might cause for the practice, for the patient? Let's start with the patient.
Sure. There's a couple things that happen. One of the things is when we don't pre-educate patients for the practice is less efficient. So a lot of doctors will tell us that they're spending too much chair time with the patient. And then what happens is the clinic flow gets backed up, and then patients are anxious and unhappy because they're waiting. So it definitely affects the clinic flow. The other challenge is that if we don't educate the patients and then they find out after they've had a procedure or a surgery that they could have had something else, then we have an unhappy patient and we have a problem with that patient because now they're saying, how come you didn't educate me? For the patients themselves, I feel, for our cataract patients in general, they typically think that they're coming in for a insurance covered procedure. So they just think they're going to come in, the doctor is going to diagnose the cataracts and their insurance is going to pay for it. And that does happen, except that now we have a lot of options for patients that are beyond what insurance covers. And it can take a patient and really expand their world again and help them see better. But what happens is they find out that this is beyond what their insurance covers. There's some out-of-pocket costs, and it's just too overwhelming for them. And then having not been educated, they just end up opting for the traditional procedure, which is still a good procedure, but they could have had something even better that might have helped them more.
Makes sense. So one thing that just in the back of my mind is when we talk about pre-education, we have to diagnose the patient first, right? We need to know what's going on and what the options are. So are you assuming somebody else would do that before they meet the doctor?
Yeah, well, it can happen a couple different ways. In cataract surgery, a lot of patients will go to their optometrist first, and the optometrist will diagnose the cataract. So that's one avenue. So those patients may end up coming to the surgeon knowing that they have a cataract. So in that situation, we can give them a lot more education than we would give someone that's just coming in. Some patients do not know they have a cataract. So the pre-education is usually based on their age and what they're saying, what their complaints are when they're making the appointment. So if someone's within a specific age range and they have specific complaints, we'll probably, what we do now is we send a standard reminder. This is when your appointment's coming, and we'll send them a general sequence of cataract videos that basically say, this is a cataract, this is how you get a cataract, and there are options now beyond cataracts, and your doctor will tell you if this is something that you're a candidate for. So it's a subtle education. We also direct them to the website so that they can get more information on the website. So say their eyes are dry, there's education on the website for dry eye. There might be multiple reasons why the eyes are dry. So the education that starts in advance either starts with their optometrist or it starts with the website and maybe some of their appointment reminders. Once they come in, when they start being worked up by the staff, we have, scripts and things that we'll have the staff tell the patient based on their chief complaints. And that's how we educate them.
When you talk about pre-education, you're also talking about pre-selling, right? I mean, like giving them that there are other options that's not covered by insurance. These are the options. These are the benefits. These are the differences and so forth, right? Am I correct?
We are. And, I think the important thing is what you bring up a good point, like what if they're not a candidate, right? Or what if that particular lens isn't the right lens for them? Because a lot of times the doctors are worried about that as well. I think we owe it to the patients to let them know that we are going to cover all the bases. And at the end of the day, when they sit down with the surgeon, it's the conversation between the surgeon and the patient where they make that decision that's best for them. But we are also, I say educating, but we are also selling, right? A lot of people don't like to use that word, but we are trying to get the patient to understand that if they actually spend some money out of pocket, they can really expand their world. They can do some of the things that they couldn't do anymore. So what happens when you have a cataract is you gradually lose your vision, your world becomes smaller, maybe you stop driving at night, right? I have a cataract, so I can tell you that's what's happening to me. I don't like to drive at night. So all of a sudden, the things that we used to do, we can't do anymore. And if we can help the patient understand that the value of maybe paying a little bit out of pocket for an advanced lens could help them do the things they couldn't do before, I think we owe it to them to let them know. And they can say no, and they'll still get a great surgery with a traditional lens, but we owe it to them to give them an option. So are we selling some things? We are, but it's more because we want patients to be fully educated so they make a good decision. They're making that decision once, hopefully, right? We don't really want them to have that surgery again.
Right. Now, thinking about what you were saying as you were speaking, one thing I just realized is, like if I hear about, I came in for X, if you hear about Y in that appointment with the doctor, and I didn't even know that Y existed, I didn't even know that Y is better for me, I might perceive it as I'm being sold something, right? As opposed to before I even come in, I hear about X, I hear about Y. Of course, we don't know exactly what's right for me because the doctor has to examine me, but here is all the different things you need to know about cataract. Here are all the possible solutions you need to know about cataract. So when I'm coming in, I'm even inquiring about why. I'm like, yeah, I would rather have why if I can have it because it's a better outcome for me. Am I making sense? Is that kind of how to think about this?
Yeah, because you are right. Like if someone doesn't really know much about it and then they come in and it's all thrown at them, a lot of times they do feel like you're just trying to get me to spend money on something I don't need, which is not what we're trying to do. But if we give them some information in advance, and even if they end up not being a candidate, I think that they're happy that they were told that there were the options available, and they feel like they were looked at in a thorough manner, and they can tell other people about it. So giving them the information ahead of time, I think, also creates a better patient journey. We don't want people to feel like we are pushing them into something or selling something. We want them to know that we have their best interest and we want them to get their best personal vision. And, you just reminded me of something. One of the medical device companies gave me a survey they had done with about 290 patients. And they asked one set of patients, they just said, you can get a traditional insurance covered procedure or you can pay out of pocket. And I think about 6% said they would pay out of pocket and upgrade. The next, but the next group, they completely educated them on the advanced technology. And 45% said that they would upgrade.
Exactly.
And the third group, to what you were saying, is they were educated on price and technology. And about 35% said they would upgrade. So I think that kind of tells us people do want to know in advance what their options are.
Yeah, I think, I'm just putting myself in the shoes. Let's say if I have this issue, I want to learn as much as I can about what it is, what the possible solutions are. At that moment, I'm not worried about price. I'm just wanting to educate myself, and I'm really eager to learn. And now I'm much more open, and I'm the one asking the question, what about why? Can we use why for me? Because I know it creates better outcomes. The doctor might say, yes, we can. Oh, no, we can't. But if it's a yes, then it's almost like the patient wants it. They're asking for it.
There are great ways to tell people also when they're not a candidate for those upgraded lenses so that they're not built up and then they feel like they got a less optimal procedure. We never want someone to think that having an insurance covered procedure is not a good procedure. So there's lots of really good talking points that we give to the staff, or I train them with on how to tell the patient what would be better for them, what would be better for their eyes and their personal best vision, so that they don't feel like I really want this and now I can't have it.
Right. So there's a lot of nuances, a lot of details. And I think depending on how they came in, did they come through optometrist or come through your office directly, etc. Now, the challenging part about pre-education is like properly understanding what they already know, what their diagnosis is, and therefore educating them, right? And of course, we all want to save time. So we can say, hey, go to the website. We can say, oh, we'll send them an email, right? So I'm just trying to understand, like, what's your experience? What are the, all of the above, options for education? And are there one or two options that are really, really effective?
I think everyone is trying to find the sweet spot and the best way to do it. And there are a lot of companies out there that have programs where they can send videos out and they say theirs work the best, or, we can tell if someone opened these or not. What I can tell you that I know works very well for us so far, as we do know that if we send a small let's say cataracts, for example, because you can do this with anything. We'll send a small sequence of videos out to them that's not more than 3 minutes. So it's not too long for them to listen to. And there might be a letter from the doctor about options, and there's probably something in there about financing. We know right now that we have a very high open rate on those videos because we monitor them. So anybody that does that needs to make sure that they should be able to monitor the open rate to see if people are actually looking at those. So what we do is we measure what we're doing and we're trying to adjust accordingly. I'm not telling you we have the perfect recipe yet. So we do that. And so if you use a program to send out the videos, you want to make sure that you can monitor that the patients are looking at them. The other thing we know is patients really respond to seeing the doctor virtually on a video. We don't have all of our practices doing that, but a lot of the practices that do it, patients really like it. It's like they're almost meeting the doctor before they come in. So social media, websites, when we can actually personalize that visit before they come in and they can actually see who they're going to meet, patients tend to like that better. When they come in, we have a questionnaire for them, a lifestyle questionnaire. Most people that are in the industry will agree that the questionnaire is very important. So you can either send it to them beforehand or when they come in. But the questionnaire helps the staff have a conversation with the patient. So it's not a medical questionnaire. It's a questionnaire about their lifestyle. Like, what are their hobbies? What is it about their vision that's bothering them? It also helps the patient think about their vision. So the lifestyle questionnaire helps the patient think about, oh, I'm really not able to knit anymore. I'm not able to garden, or I can't drive at night. It also helps the staff have a better conversation with the patient. So the videos and the questionnaire are critical, but the most critical piece, which a lot of people say the jury's still out on, but a lot of my peers will agree with me, is having a patient counselor or educator meet the patient before they meet the doctor. That person sits down with them. They have some information because the technicians have worked them up. They give them an idea of what the doctor is going to talk to them about. They can use videos or simulators to show the patients how they currently see and how they may see. And that, to me, is the key, to have the patient educator in the process. And that reduces the chair time for the doctor. It eliminates a lot of challenges that happen between when the technicians have the patient and when they go to the doctor. And I know that when we remove those people, because I do monitor that where I am now, when we've removed the counselor for whatever reason, we see a decrease in the advanced technology lenses. We see wait times increase. We see the doctors complaining because their chair times increase. So the critical component, I'm going to tell you, is the patient counselor from my point of view.
No, I think that makes total sense, right? Because this person is the expert who's showing them what the solutions are, what the benefits are, and really spending the time. And of course, they can spend a lot more time, the doctor can.
And they can, put them at ease. People are anxious, and they can say to them, you're going to see me again at the end, or when you see the doctor, this is what he's going to talk to you about. And just, people are very anxious when they go to the doctor in general. So anything we can do to just help them know that they're in the best of hands, and just say to the patient, you're going to meet Dr. So-and-so. He or she is an excellent surgeon. You are in great hands.
Yes. You're credentialing them right off the bat. So instead of oh, he's just this random person I said hi for the first time, as opposed to, oh, he's somebody I'm so glad I can meet today because he's really good at what he does. And he was credentialed right off the bat. So which is amazing.
And you know what? It is hard to quantify, when can I hire that person? Because, I have to pay another salary, and how do I quantify that? And it is difficult to quantify it. It's like the chicken or the egg. What do you have first? Do you, here and then you hire the person, or do you hire the person to be busier and have a better patient experience?
Yeah, I mean, the more I think about it, even my ophthalmology experience, usually tech ophthalmologist, I don't have this patient educator in the middle, and it's kind of disjointed. It's like, it's weird. Something is happening. You have no idea what's going on because the doctor is busy. He's not going to be able to explain things. And even the tech is just looking at stuff, like they don't talk to you. They're just doing their tests or doing their, whatever standard thing they're going through. They're not necessarily the educators. So either you make your tech the educators, or you build that role, right? So
and you can do that. You know what? We do that too. We teach some of the technicians to educate. We have some practices that the technicians are educators, because every person is important in the practice. Every touch point along the way, people should be educating the patient. And we do have some doctors that don't want counselors. They feel uncomfortable with it. They feel that they would rather do all the educating, but those tend to be the practices where we have longer wait times. There's always an exception to the rule. We have a couple phenomenal doctors that educate like you wouldn't believe, but that's not the norm for that.
Mm-hmm. No, that makes total sense. Yeah. So we talked about lots of things. We talked about what is pre-education, why it's important, the implications for the doctor. We talked about the implications for the patient. We talked about some of the biggest benefits, which is it is kind of like pre-selling, especially when the patient can upgrade or pay out of pocket for additional benefits, which of course is good for the patient and good for. So it's really a powerful way. The pre-education is a powerful way to also pre-sell. And we talked about the keys to success, videos, short videos, sending it out early, looking at open rates, seeing if it's really making a difference. We talked about the concept of the patient educators and how powerful that is, at least in your experience. Doesn't mean you need it, but somebody has to do that role. If the doctor is, busy and doesn't have enough time to really be patient with spend the time with the patient, then this is a powerful role. And like you said, the nervousness, right? A lot of people, when they know they have cataract, they're like, oh my God, I'm going to do something to my eyes, and they're nervous. So that is really stressing them out. So here, having someone who's on their corner, who they're going to meet with, and that person reassuring them prior to the appointment with the doctor, and even credentialing the doctor, right? So they are like looking forward to seeing the doctor. They're not just random doctor. They're this great doctor who I was told about just 5 minutes ago.
Right, because what are people afraid of? You just brought that up. What's going to happen to my eye? Am I going to lose my vision? Am I in the right place? Did I pick the right doctor? So all of that education is also, like you said, credentialing the doctor and making the patient aware that they are in the right place and we're going to take care of them.
No, absolutely. I think I sometimes feel going to my ophthalmologist is like going to a black box. I don't really understand what's going on. I might get 40-50%, but I'm like trusting, in God, and this guy's going to take care of me, but it's like blind faith. But imagine if that comes with education and giving me the time to ask my questions and get my concerns addressed.
There's a percentage quote that I use all the time, and someone told me this quote a long time ago. They read it in a book. I didn't make it, this is not my original quote. And then I look up the statistics all the time, whether it's audiology, ophthalmology, whatever. But typically I tell people when I train them, most people in a consultative approach, or even during this podcast, right, they'll remember about half of what they heard. And that might be because they're distracted, they have to go somewhere, they're hot, whatever. Of the 50% they hear, about 25% of that they hear incorrectly. So the patients are usually going home with about a quarter of the information, and it's not all correct. And that's why they're always calling us back. You didn't tell me that. You didn't tell me I had to use those eye drops. And again, that just circles back to, why do we need to be patient ready? Why do we need to give consistent messaging? Like, why? Because we want people to be able to take in information and understand it.
100%. Last question I have. What about visual aids in this education process? Any specific visual aids you found useful?
Yes, I'm so glad you asked me. One of the disadvantages we have in ophthalmology, like versus aesthetics, right? Aesthetics, you can show before and after photos, and people can say, oh, I really want to look like that, or I like the work that doctor did, right? It's very hard to show the work that the doctor did in ophthalmology because we don't know until we experience it, right? But we can simulate it. And so visual tools are unbelievably important, and they can really speed up the process, because we can take a visual aid. There are some simulators out there, different companies that have these simulators, and we can pull up side by side. This is probably how you currently see at night. Are this what the headlights look like for you? And they can say yes or no, we can fix it. And then we can show them, with this particular lens, this is how we anticipate for you to see after surgery. And that way, say there's a lens that we're suggesting for a patient that does have a side effect of causing glare and halo. We can show the patient that what they're going to get is going to be much better than what they currently have. You can show them the difference between astigmatism, which seems to work really well with the visual aids. This is how you currently see. If we give you a standard traditional lens, you're still going to wear glasses because we didn't correct your astigmatism. If we correct your astigmatism, this is how you'll see. So there's simulators that are available. All of the medical device companies have them. And there's an animation company called Rendia. I don't work for them, but a lot of people know who that is. They have a simulator. Alcon has a simulator. I'm sure J&J and B&L have one as well. And the eye model is my favorite visual aid. So all of our practices are instructed to have eye models in every room, because they can just take the lens and say, this is the lens in your eye. And when you have a cataract, it gets cloudy, and they can show them the cloudy lens, and they can say, we're going to replace that lens with a clear one. So eye model, simulators, videos, all really great visual aids.
Yeah, I think the more that you can help them experience it at some way or fashion, I think the more they're going to be convinced, that this might be the better solution for them. Thank you so much. I really learned a ton, and of course, I think we both had fun. So thank you for this awesome conversation. And any final thoughts as we wrap this up? And also, if people want to follow you, of course, we're going to include this video and the podcast on our website with complete show notes, so people can go to the website obacademy.com and grab all of that. But if people want to get a hold of you, how can they do that, Christine?
They can definitely contact me at Christine Lapointe at Eyecare-Partners.com. They can also email me at my personal email, lap2913@gmail.com, and they can call me as well. Do we have my phone number? Will my phone number be listed on the podcast?
Yes, definitely we'll list it.
Yeah,
we'll list all their contact information. So why don't you share it with us now?
954-770-2599. And I would just say in closing, and thank you for having me, because I'm so passionate about the patient journey. I would say in closing, for the wonderful ophthalmologists that I get to work with every day, and the wonderful optometrists that I get to work with every day, thank you. A lot of them are really great with the patients. And when I say that they may not be great at educating, I don't mean that they're not good at telling the patient what they're going to do. I just mean that it's very difficult for them to reduce that amount of time and give the patient everything they want in 5 minutes. It's too hard for them.
100%, right? It's just part of it is you're addressing their concerns. Part of it is you are kind of helping them make a decision, and you can't do that in 5 minutes. You need to have a lot more time.
And we want them to be able to use their skills the best way they can and be efficient. So when I say this, I say this in the sense that we want to make the doctor's piece efficient and help them be able to do what they do best, whether it's the optometrist or the ophthalmologist. And we want the patient to really feel good about the experience. So when we pair those two together, we get a great result.
100%. I totally agree with you. It's the combination that produces the amazing experience for the patient. Thank you so much, Christine, for joining us today and talking to us about the importance of patient education and patient readiness with cataract patients specifically prior to them meeting the doctor. I also want to take a moment to thank our listeners. We appreciate each and every one of you. We cannot do what we do without you. If you like our podcast, please share it with your friends on social media. Also, don't forget to write a review for us on iTunes and Google Play. Your reviews will help other doctors and practice owners find us. Till we meet again, wishing you all an amazing week ahead.